find a good place to start and kind of understand the basics behind a research paper, presentations, and designing a study in the first place. So we'll get started. So in this talk, we're going to understand the basics of clinical research, its value to medicine. We're going to recognize different levels of evidence, different types of study designs, and how they relate to how they actually matter in clinical practice, which is the basis of every research study. We're going to see how effective literature searches are conducted, which are critical in both formulating a research question, conducting a research study, and evaluating the kind of potential and effects of each research study. And then we're going to talk a little bit about presenting and kind of disseminating your research through scientific posters, manuscripts, publications. So let's get to it. So what is clinical research? So it's a systematic investigation involving human participants, drugs, devices, data, all different types of tools, and kind of trying to understand how this relates to a specific disease, device, or the practice of medicine. So clinical research is going to be used to generate knowledge to improve patient outcomes ultimately. And doing so, we guide innovation, practice guidelines, and policy. Just as an example, I was talking with someone the other day, the kind of guidelines for lung cancer screening have changed to an earlier age just because of the vast amount of studies and publications among all different types of study designs that have led to, have shown proven benefit that earlier screening leads to better outcomes in people. So these skills are important to develop because they help with critical thinking and learning among both yourselves and colleagues. So that's why it's important to do clinical research. A lot of people aren't totally sure what clinical research means. Research to a lot of people means wet lab, basic science, bench work. This is kind of to let everyone know that it's more than pipettes and Excel, and we're looking at crude data a lot of the time. So doing clinical research addresses gaps in care and kind of helps navigate unanswered questions in medicine. Like I said, we can evaluate new drugs, devices, and diagnostics that might not necessarily have proven benefit yet. While drugs, devices, and diagnostics are regulated by the FDA, physicians aren't necessarily regulated by the FDA. So, as a physician, if you believe and have sufficient evidence behind certain drugs, devices for a specific disease process, you can employ those metrics to treat your patient's disease. Whereas something like a company is not able to do that because they're very tightly regulated in the United States. Advancing health equity is another reason to do clinical research. We can look at gaps in care among different populations, among different places in the world, among different types of treatment, both throughout the United States and throughout the world. So it's important to bring those gaps to light through clinical research and data. Clinical research helps us to improve quality by changing existing processes and workflows. So if a process isn't necessarily working the right way or costing too many resources or is not necessarily as efficient as it should be. So clinical research is going to help us examine those things. Lastly, professional development connection with mentors is an important point. It's not, this is not something that one person can do alone. Many of the times, a research project involves a team consisting of students, professors in the field, seasoned physicians, both new and seasoned physicians. So, developing these connections are going to foster both learning and mentorship throughout. And lastly, persistence, statistics, storytelling, and exploration are important points. So it's a process. It's never a linear process. Throughout the process of clinical research, you're going to be going back, reevaluating the question, reevaluating your methods and results, and formulating this story so you can explore a specific process. So, where did these research questions come from? The research question is the basis of your research study. So, a lot of the times, for clinician people in medical settings, it comes from clinical encounters and from patient feedback. So, you have a clinical encounter that you have a question about, or is not necessarily answered in the literature, or a disease that's not well documented. Feedback from a patient on drugs, devices, diagnostics, like we were speaking about earlier, that may not be working as well as we're intending them to. Inconsistencies in current literature. So someone has a question, and we're going to look at how to examine current literature. But looking at the gaps in current literature are going to be a source of developing a new research question and answering that question. Emerging technologies and therapies, new devices emerging. Quality improvement in public health. So those are important points of developing a research question. How can we improve the quality of different things in the hospital, and look at global and national public health data? Policy changes and guideline updates or other forms of research questions, as well as underreported disease and outcomes. All right, so an important point, the bottom line, is to write down questions, interesting points to explore both, in really any experience, whether you're in a clinic, whether you're working, shadowing, rotating somewhere, if you're in the operating room, if you're in your classes. It's good to write down things that you're not totally sure of so that you can conduct a literature search on that. And if there's a gap, you might potentially be able to conduct a study there. So a little bit about developing a research question. So it starts with an observation, like we said, and a need. So you want to ask yourself, what is the topic that you've identified in developing a research question? Let's talk about brain tumors, for example. So what's the context of the topic? Why should you explore this? Is there not enough known about a specific type of brain tumor? Is there not enough known about the outcomes down the line after surgery of brain tumors? So what's the reason to explore it? What's the background information that you need to tackle that question? So, what kind of information do you need? Do you need information about the surgery? Do you need information about the patient presentation? Do you need to know what patients do afterwards, where they go home, staying in the hospital? So this kind of framework has been developed, and it's kind of well used and well known. It's called PICO. So PICO stands for Population Intervention Comparison and Outcome, and it's used for a lot of quantitative studies in order to develop a solid research question that you can tackle. So we'll take a look at it in the next slide. So PICO, like we said, stands for what's written in the table here. So the first population or the problem is going to be your kind of sample set that you're going to define. So with the P, you're going to ask yourself, who's the group of people that you're studying? So the example here is adolescents with type 2 diabetes. The second letter is intervention. So what's the intervention that's being investigated? So what are we looking at? So in the actual study, in this case, it's telehealth consultations. So in adolescents with type 2 diabetes, we're studying telehealth consultations compared to what is the comparator that we're looking at to evaluate those telehealth consultations. So compared to in-person consultations. And the outcome that we want to look at between that intervention and the comparison is blood sugar control. So in total, the PICO question that you're going to formulate is, in adolescents with type 2 diabetes, how does telehealth consultations compared to in-person consultations affect blood sugar control? So that's a solid answerable question that you can tackle in looking at current literature, previously published studies, and then go on to answer in various methods that we'll talk about. So another mnemonic that's widely used is called SPIDER. So while PICO is more for quantitative studies using data and measurable metrics, SPIDER is more of a kind of a mnemonic that's used for qualitative studies. So looking at more descriptive studies. So it stands for sample, phenomenon of interest, design, evaluation, and research type. So when you begin with your SPIDER framework, you want to ask who is being studied. So in this case, brain tumor patients, stroke survivors, caregivers, or residents. What's the phenomenon of interest that we are studying? So in brain tumor patients, we can look at the recovery journey, the perception of their treatment, coping strategies. What's the design of this qualitative study? So it can be interviews, focus groups, surveys. So these are all qualitative metrics. Evaluation. So what are we actually assessing? So within brain tumor patients, recovery by looking at interviews, we can take a look at themes, beliefs, attitudes, and subjective outcomes. And lastly, you can complete the SPIDER mnemonic by looking at what the research type is. So is it going to be a qualitative study? Is it going to be a mixed methods, qualitative and quantitative study? So these are kind of frameworks, and here's just another short table that's reiterating what was on the last slide about the spider framework. But the bottom line is that you need to formulate a research question, and these are useful tools in doing so. So if I can just take a look at my browser, I wanted to share some resources where you can look at research questions. So um, lots of universities are going to have your university or your hospital system. For example, Hofstra and Northwell has a library page. So it's good to access your university library page and where you can access different types of resources, so different databases, different searches, and take a look at the current literature. And we'll dive deeper into this. So if you're not already familiar, it's good to get into contact with your university librarian or research person, if there is one, to find where the resources are in order to answer your question that you formulated. The next thing that I wanted to talk about was UpToDate, which is another resource, and it's an evidence-based kind of software that clinicians use real time in the hospital to look at the most recent guidelines for treatment and diagnostics and of each disease. So, for example, on UpToDate, I've searched here management of type 2 diabetes. So if we take a look at the first link, this is going to be an evidence-based, like clinical kind of framework on how to approach adults with hyperglycemia who have type 2 diabetes. So it's going to bring me through um, different resources, education, therapies, diagnostics, monitoring. So the bottom line is that this is another resource that can be used to formulate your question, kind of find gaps in literature in order to solidify your research question. All right, let's get back to it. So, taking a look at some overviews of study design. So, study designs, once you formulate your question, come in a whole host of different types of categories. So, descriptive studies are more qualitative, like we looked at with the Spider framework. Those can be case reports, case series, among others that kind of describe a unique single or series of cases that maybe you've seen on a rotation or in the hospital or shadowing. And that can be reported in the literature as something novel. So the point is that it needs to add something to the literature. It needs to be useful in a way that it brings new knowledge. So typically they're reported on rare disease processes or treatments that are not really reported. Observational studies are a little more quantitative, so they look at cross-sectional case control or cohort studies. So those are three different types of observational studies that look at groups of patients, whether it's in one time point comparing to a control or looking at a cohort in the past or in the future. Experimental studies are a step above, and an example is randomized controlled trials, which I'm sure a lot of people are familiar with here. So randomized controlled trials take a intervention and they compare it to a control and assess the outcomes in a very systematic way. Secondary studies are sort of a sum of the previous three studies that we've talked about. So they're systematic reviews, scoping reviews, narrative reviews that are typically used to synthesize the current literature of throughout descriptive observational and experimental studies in order to understand the current state of literature, whether it's in a systematic way or in a narrative way. So that's going to help us understand the current state of the literature, and typically they look at the entire. They look at a broad literature search, so that's the basis of these studies. Um, Lastly, big data registry database studies. There are lots of available population-based national and international registries that your university or school might have access to, and you can access those databases to query them for different types of diseases, treatments, and processes to look at a study that way. All right, so the hierarchy of evidence. So this is kind of what we talked about in the last slide. So each study type is sort of a higher level of evidence than the previous. So we start with on the bottom here with in vitro animal research, which kind of sets the stage and the foundation for research for clinical research. As you can see, it's higher in the pyramid. So if you, let's say, for example, if you have brain tumor patients or you have a new drug that you're looking at in brain tumor patients, typically it's conducted preclinically first in animals or in vitro research before it's reported on in humans. So it sets the foundation. Editorials and commentaries come after. And then come case reports and case series, like we spoke about. So this will be in humans in one case or a series of cases, whether that's use of a novel drug, description of a novel case. So those are case reports and case series. One step above is going to be case control studies. So case control studies are going to look at we'll look at this in the next slide as well. It's a few cases and looking at controls who are similar to those patients and then examining risk factors for developing a specific disease or outcome. Cohort studies can be retrospective or prospective, looking in the past or looking in the future, and they follow a set of patients in order to look for they follow a set of patients with a specific risk factor in order to look at a specific outcome. At the top of the pyramid, we have randomized control studies, which can be blinded in different ways, as well as systematic reviews and meta-analyses. So randomized control trials we spoke about a little bit, looking at an intervention compared to a control. And then systematic reviews, meta-analyses are kind of the top of the level of evidence because they'll be able to synthesize everything below them into in a systematic approach in order to determine where the best evidence available is. All right, so looking at the temporality of different study designs, this is somewhat similar to the hierarchy pyramid we looked at in the last slide. So it just gives you a time-based approach. So clinical trials, randomized control trials, we're looking at a treatment group and a control group and comparing in the future, right? So we're going to be following from the present to the end of the trial about what in which group, like the frequency of the outcome of interest in each group. Prospective cohort studies, they also start in the present and go to the future. So it's following a group of patients that have or don't have a specific risk factor, and we compare the disease incidence in those patients. Retrospective cohort studies are similar in that you start in the past and you move towards, further in the past or into the present. But it's the same idea in that you're following a group of patients with and without risk factors to compare the disease incidence. A case control study is looking at patients with and without disease and comparing risk factors in the past. And cross-sectional studies are kind of what it says, cross-sectional, looking at in the present the disease prevalence in people with certain risk factors. All right, so now that we've kind of understood different types of studies and formulating a research question, we want to be able to conduct an effective literature search. So um, PubMed is one of the databases that can be used for literature search, among others, Embase, Scopus, Cochrane. There's lots of them that we can take a look at. And really, it's about searching the database effectively. So we'll take a look at what's called Boolean operators. So they use the words and, or, and not among different search terms. And we'll look at an example of that in order to create a precise search so that you can answer a specific question. MESH terms stand for medical subject headings. So this is kind of a way in which PubMed indexes different studies into subheadings and subcategories in order to classify different studies under different terms so that selecting a MESH term allows you to have the most representative studies within that term. So we'll take a look at those as well. PubMed has lots of field tags that kind of are in brackets. So you can search by journal, you can search by author, you can search by institution. So that allows you to narrow your search as well. And you can utilize filters to narrow down your search by study type or language. And lastly, you can set alerts for a specific search. So if a new study comes in, if I search for the word glioblastoma and a new study is published this week, I can get an alert if I'd like that. All right. So why is this precise way of searching better than searching just the same way you would on Google, as in like a sentence or a string of words? So the reason that using this precise method with Boolean operators is better than just a basic search is because it allows you for greater precision. So it allows you to include or exclude relevant terms. So for an example, if I wanted to look at stroke and the connectome, it results only articles containing both. So it allows you to either broaden or exclude different things, like we said. If you join two terms by the word or, it's going to broaden your search and include all articles, for example, here that contain the word glioblastoma or GBM, because different studies can refer to the same things in different ways. The word not is going to be able to exclude different terms. So if I want to look at brain tumors, but I don't want to look at any benign tumors, and I want to exclude all of those papers that talk about benign tumors, I can use the word tumor. I can take the term tumor and join it with the word benign with the word not in the middle, so that I don't include any studies that talk about benign tumors. So the bottom line is that it allows for reproducibility. And this is something that you can write in the methods of a study, that you conducted a specific search with specific terms and operators, so that someone who tries to reproduce your study it allows them to conduct the same exact search in a very systematic way. And then lastly, it kind of like we said before, it helps create a precise search so that there's no algorithm bias from a basic search in the bar. So, for example, this is an example here. This is something that I look at, connectomics in brain surgery, in brain tumor surgery navigation. So this is kind of the way I would search on Google if this was kind of a term that I wasn't completely familiar with. I would search connectomics for brain tumor surgery navigation. So you can see this yields about 5 results on PubMed between the years 2021 and 2025. So there's 5 studies that PubMed has kind of determined include this search. So the reason that a more precise search is going to be better than this search is something that you'll see on this slide. So this is a very similar search. So I've pasted it below here. It uses connectome or connectomics joined by the word or. So it's going to include all studies that include either of these terms, and tumor or neuro-oncology, because it can be referred to as in either way. This is going to be joined by, as you saw in the previous slide, I used the word navigation. So I added some synonyms of navigation with the words guidance, plan, planning, intraoperative or intra-operative. And then lastly, I joined that by surgery or resection. So you can see this yielded 90 results, which is a much broader search with using very similar terms. And the reason that happens is because I've added these words or that are kind of broadening my search to include lots of different terms that are similar but may not be used in all studies. So while one study might refer to their brain tumor surgery navigation metrics as the word navigation, another study might refer to as guidance or planning. So that helps me broaden the search, and that allows you for a more precise, systematic review of your literature to answer your question. All right, so we spoke about mesh terms briefly, so I'll go back to the browser here. So mesh terms stand for medical subject headings. So they're a way of organizing different studies that PubMed uses to index different articles. So for an example, if we search for glioblastoma and we search under mesh terms, it's let's see, strange. If we go into brain tumors, oh, it's really strange. All right, well, it doesn't want to open, so that's okay. Basically, if we search for glioblastoma or different types of gliomas, mesh terms will be able to kind of create subject headings. So first, kind of the most broad term will be cancer or neoplasms, and one step under that is going to be brain neoplasms, and one step under that is going to be glioma, and one step under that is going to be glioblastoma. So there are broader and more specific terms that you can use to search for different subjects, and that'll result you different types of articles that include those subjects. So that's just another way of creating a precise search. All right. Other key databases to use besides PubMed, I spoke a lot about PubMed. Embase is another database that it can be a little more broad, including other types of articles, including abstracts and conference presentations, Web of Science is another database, very similar. It also has a really cool citation tracking kind of software, which allows you to look at how much an article has been cited, and that kind of gives you a metric of how popular this topic is within a year or a span of years. Cochrane Library has a lot of systematic reviews and trials, so those higher level studies that we talked about. And then clinical trials, Gov looks at different clinical trials in the United States as well as internationally. And then there's a similar database at the World Health Organization where you can similarly search for different terms and look at ongoing and completed clinical trials. All right, this is an example of the citation tracking that Web of Science has. So, if I search for the word glioblastoma, it can tell me how many times studies have been cited, or a specific study has been cited with that term, with the sum on this line here. So that allows you this gives you data. This is something that can be created into a study. If your question was, how popular are studies on glioblastoma, or how many times are people publishing on glioblastoma? That's a study design in itself. All right, so peer review articles versus abstracts. So this is an important distinction because you'll go and find in lots of these databases that abstracts and conference presentations will be available. So abstracts are brief, preliminary, limited kind of studies that are not necessarily peer reviewed. So it's important to make that distinction because abstracts are typically kind of small snippets of studies that have been completed or are almost complete and are typically used to present at a conference, but they're not peer reviewed. So it's important to look at to take them with a grain of salt because they have not necessarily been reviewed by a board or by a journal. Full articles, they have detailed methods and data, and the published full article typically have undergone a rigorous peer review process. So these databases that we took a look at are going to kind of look at both publications and abstracts, and those will typically be denoted in each link. And just an important point about articles and abstracts are that a lot of them are kind of behind paywalls because of journals and journal publishing regulations. So you can get past this using your specific library, university, college, or school library kind of search database, which is what we took a look at a little bit earlier, or contacting the authors. A lot of times I personally have had experience and success with reaching out to people who have written an article just to ask for the full version, and they're happy to share it. Okay. Other forms of clinical data, so case reports, the electronic medical record, and institutional registries are places where you can get patient data. It's not always accessible if you're not always in a hospital or don't have access to records at a hospital. You can get access to something like this by working with different physicians, whether it's during your rotations or shadowing or working with anyone in healthcare. Another source of data is the National Inpatient Sample. So the National Inpatient Sample is this kind of sample of hospitalizations in the United States, and it's a 20% kind of representation, kind of organized by ICD-10 code. So you can query that database for looking at what types of patients have been admitted to the hospital. This mod data is a kind of an adverse event database of reported device dysfunctions in the United States. Other databases are the epidemiology database and the surgical quality improvement database. So these are all things that are most are readily accessible. So taking a look at different studies, so conducting a literature search, you want to take a look at each section of the study and understand each section and kind of determine how each section was written and evaluated. So looking at a study when you're conducting a literature search, the introduction in the background section of a study should be clear. It should give you a rationale for the study, and it should give you adequate background on why the current study isn't it should give you adequate background on the current state of the literature, as well as why the current study that you're reading is different from current evidence. The end of the introduction of research articles typically talk about the objective or what the question that the article is going to be looking to answer. In the methods section, it should clearly state the inclusion criteria of the study, what outcome measures were used, and what the study design was. Looking at the results of a study, they should kind of follow a logical and clear presentation way. It should be able, each results section should have tables, figures, as well as well written out text that show different types of data that was evaluated in the study, so that these can be discussed in the discussion section. Excuse me. All right. The discussion and conclusion sections should integrate findings with existing evidence. It should tie in the results section, what was found in the current study, as well as tie that back in with the introduction and the objectives that the study was going to find in order to understand what the study actually accomplished and how that relates to current literature. So the discussion also acknowledges limitations and biases of the study, and proposes future directions. It's important to avoid overstating conclusions. Common mistakes are assuming that correlation is causation, which is not. It is not. So it's important to make those distinctions when making the conclusion to the study. The conclusion of a study should typically not be more than 1 or 2 paragraphs, and it's typically a short form to understand what the takeaway of a study is. All right. Just going through a few different types of studies that we talked about and how to navigate these studies if you aren't completely familiar. Looking at case reports and case series, they're typically a detailed summary of a unique or instructive patient case. So they're used for rare diseases, diagnostic challenges, unexpected outcomes, or novel treatments. So navigating writing a case report or case series starts with descriptive title. An abstract is typically short that kind of tells you what the main takeaway of this report was. The introduction is going to be pretty comprehensive for a case where it's going to detail what the clinical problem is, why it matters, and how it relates to previous literature, as well as how it's different from previously reported evidence. The presentation is going to be the base of this type of study, so it's going to have a detailed kind of presentation of the age, sex, relevant history, symptoms, exam, diagnosis, treatment, and outcome of this patient. And it's going to use a clear timeline to show the reader what the novel aspects of this case were. The discussion section is again going to reiterate how this case compares to a previous case in literature, as well as what's novel, surprising, or instructive about it. Lastly, the conclusion should be summarizing 1 to 2 sentences and to talk about the main takeaways. A narrative review, another level of evidence that we spoke about earlier, is looking at kind of synthesizing the current existing literature on a broad topic in a narrative way, which is looking at different sections and kind of organizing this review paper by different concepts, timelines, controversies, or mechanisms in order to summarize and synthesize findings. Maybe these papers typically include critical discussion among strengths and limitations of different literature, what the unanswered questions are, as well as future directions. Some tips on conducting a narrative review. The reason I'm talking about these types of studies are because they're somewhat easier to conduct rather than large-scale data studies that are that might take a lot more manpower to conduct. So it's good to search different databases, PubMed, Scopus, Embase, Google Scholar. We talked about some of these. It's important to include figures and tables that kind of represent this in a meaningful way. And it's important, lastly, to avoid excessive quoting of different studies, rather synthesizing, analyzing, and summarizing the current state of existing literature. Okay. Next is a systematic review. It's about kind of 1 step ahead above a narrative review that kind of approaches synthesizing literature in a systematic way. So we spoke about PICO. So it starts with a clear answerable question with PICO. It moves on to a comprehensive search strategy searching different databases, mesh terms, and inclusion and exclusion criteria so that you can answer that specific question that you formulated in the beginning. Extracting data from during a systematic review, as the title goes, it's in a very systematic way. We're looking at different study designs, outcomes, samples, what the interventions were, and what the outcomes among that specific kind of comparator were among different studies in order to synthesize it in a kind of organized way. Systematic reviews, a lot of the times, can be done with meta-analyses. So a meta-analysis is pooling data from different types of studies. So if one study, if you have multiple studies reporting on cohorts of 20 patients, 100 patients, 200 patients, you can analyze those kind of studies into a group in order to devise a pooled data kind of summary. All right. So these are just some types of different types of studies, and you can see that these are all publishable, kind of meaningful studies. And the reason I'm going to be showing these is because of the different methodologies. So this one is a scoping review of the literature. So in essence, a narrative review was performed to look at different types of studies among functional connectivity and fMRI in neurologic disease. So this was the narrative review we were speaking about earlier. A case series, like we were speaking about earlier, looks at a unique series of cases. So in this case, it was subcortical stimulation for brain tumor resection. So this wasn't reported on much in the literature, which is why a case series was published. A bibliometric analysis, we were looking at Web of Science earlier. So this is a study design in itself, looking at the most cited articles among a specific topic. So in this example, connectomics, looking at what are the most cited articles in the field of connectomics and why do they matter and why are they being cited so much? So this is another way of examining the current state of the literature. This study type is a survey of trainees. So it's another study design where surveys were sent out to different trainees in neurosurgery to look at their attitudes towards extended reality. So another study design looking at that's very feasible because they surveyed people throughout the country. Lastly, we spoke about systematic reviews and meta-analyses, and you can see this was after they searched. They identified 26 studies among their search and kind of synthesized evidence essentially on tubular retractors and glioma surgery. So the point is that these are all doable, feasible studies that can be done without necessarily having access to large-scale data, whether that's in a hospital or any type of medical setting. So a couple slides on kind of disseminating your research. So once you've conducted your study, made your question, done your literature search, conducted your study, completed your study, it's important to disseminate your findings. So this kind of starts with abstracts, as we talked about. So abstracts can be presented in a poster version at conferences, and that helps with networking and kind of disseminating your findings, learning about other kind of research that's related in the field. So designing a poster presentation should be clear and visual. The goal is to have a visual kind of storytelling experience. So it should start with backgrounds, methods, results, and conclusions, and follow a very clear cut kind of organizational way. And essentially, you should practice a 1 minute kind of talk about your poster presentation because you are a person conducting the study and essentially the expert on what your study was about. So these are some subheadings that you can use in a poster presentation, and we'll look at some examples of that. So this is one example of a template. So a poster presentation can start with a background, describe the purpose, the methods, the results, and the interpretation, as well as with pictures, figures, tables that would be useful to show to different audiences while you're presenting this. So it always ends up having too much text. So it's important to kind of follow this kind of ratio because it's difficult when you've conducted this study where you've examined literature or examined different cases, different studies, and uh, the important part is to portray it in a way that is visually appealing. So the ratio that most people follow is 20% text, 40% graphics, and 40% empty space. So it's important to have text kind of be the lower end of the spectrum, with graphics, visually appealing, visually appealing tables, figures, taking up a lot of the space. Here's an example of a poster that I did that has too much text. So you can see there's pictures in the middle, but really there's a lot of words kind of taking up the space, which isn't necessarily ideal. Another example is here. So this is a little bit better. The purpose is very short. The materials and methods are listed, and with a short results and conclusions section. The majority of this poster is taken up by figures, tables, and kind of graphical representations of what the study was. So this is a much better representation. All right. So the takeaway of a presentation should be what the question is, what the significance of that question is, the approach that you took to address a specific problem or answer your question. What did you do? So what were the results of the study? What did you find? And how does this, what does it mean? How does it relate to current literature? What's the interpretation? And what are the future directions? So these are kind of questions to ask yourself while creating a presentation of your study. All right. So wrapping up here, we're talking about kind of the end stages of a study is going to be writing a manuscript. So obviously very important, but again, not a linear process. So the title of a manuscript should be descriptive, include study objectives. The abstract should be a very succinct overview, often less than 300 words. The keywords of a manuscript typically come after the abstract, and they're made last after the entire study is written. So starting with the introduction, it gives the context, it kind of examines what the gap in the literature is, and then ends with the objective. So we talked a little bit about this in appraising different studies. So the introduction section seeks to briefly discuss the existing literature and the rationale for the current study. So examining what the current literature is, why there's a gap, and how this study is going to aim to bridge that gap. The methods of every study should be transparent and reducible, whether that's for a case series or synthesizing literature for a narrative review, the steps you took for systematic review. So that is going to clearly describe the steps that were taken so that other people can replicate the study and validate it. The results section should be concise. Like we said, it should have data, tables, figures, and visually appealing graphics. It should really be a clear description of your findings of the study without specific interpretation. That interpretation is meant for the discussion section. So it's meant to interpret, compare your findings to previous findings and discuss limitations, and kind of consists of a further discussion of literature, how this finding compares to previous literature. The conclusion, lastly, we spoke about earlier is a succinct take-home message. Really, in a manuscript, it should be 2, 3 paragraphs or less, and is synthesizing what the takeaway points of your study were. Lastly, I want to mention that drafts are drafts, so it's important when you've conducted your study to just write. Every draft is not going to be perfect and doesn't have to. It's more important to get words on paper and refine your draft from there, whether it's just putting your thoughts on paper or writing brief write-ups of what previous literature examined, and then going back and tying that in with your results. All right. Some important tools while writing your manuscript are citation tools. So some software that do this are EndNote, Zotero, Mendeley. We'll take a look at why these are important. So let's say I'm writing this paper. So this is an example of a paper. And what EndNote is going to do, it's going to be able to enter references. So it's important to cite references while you're writing a paper. So if this is the introduction section of a research study, and we take a look at a sentence here. So the reason that EndNote is useful is because it'll allow you to automatically insert a citation within Microsoft Word while you're writing. So this is what the EndNote library looks like on the left side of the screen here. So I'll be able to search any study and kind of add it to my EndNote library. So if we look at this first study on aromatase inhibitors, it's something that I can search on PubMed. There's a PubMed tab right here. I can add it to my library. I can read the paper. And then if it applies to my study, I can cite it while I'm writing about aromatase inhibitors in this paper. So I can go to insert citation and insert that citation as number 11 or wherever I'd like to. The reason this becomes important is because when you're going back and editing your draft, let's say I want to, I can tell you that this study had over 200 different references that were cited. So if I want to go and add in a new reference, before number 12, after number 11, that is going to shift every reference from 12 until 200 by one. So instead of manually kind of fixing the entire manuscript draft, EndNote automatically does this in a very organized way, and then also creates a references bibliography page at the end of your study and automatically updates that as you go along. So really useful tool. The other ones that I mentioned, Zotero and Mendeley, do this in a very similar way. Okay, these are some resources and further reading from where I kind of made this presentation from. Feel free to take a look. And that's it. Thank you.
Okay, amazing. Thank you for all of that. Understanding research is such a daunting process, and there's a lot of things that I've learned along the way in there and helpful things for the brain turns to take home with them. Um,
Right.
yeah, we have some time for questions, right? Let's
Sure,
see.
yeah. I think we have a few minutes.
So as a first year international medical student, what types of research would you recommend to build a strong foundation?
Yeah, so that's a good question. I think that it's important to kind of first formulate your question. So a lot of and formulate your question and find mentors. So it's not necessarily what types of research. I think it's more so the groups of people that you can find and the mentors that you can reach out to. So I would recommend kind of finding a field that you're interested in. So what I'm working on is connectomics and glioblastoma. So it's important to reach out to people who are experts in the field. Obviously, I'm not an expert in this field. I hope to be, but currently I'm not. So it's important to reach out to people, first of all, to find mentors. And that doesn't include just I'm interested in doing research. It's more of like um, it should be more of a specific kind of request. So let's say you send an email to someone who is an expert in the field, and I'd say don't be afraid to reach out because people are happy to have students and trainees help. So it's important to reach out to experts in the field, one, and kind of approach them with a goal, right? So you can say, I want to work on glioblastoma research in a specific, looking at specific regimens of chemotherapy and radiation. And you can explain to them why that's something that interests you, right? So the first step is going to be finding something that interests you, formulating a question, looking for experts in that field in order to help you answer that question. So it's great to be thinking about what types of research to be doing as a student, but I think it's more important to um, kind of have a team that you can decide that with, whether answering your question takes a case report, a case series, a systematic review, a narrative review, or other types of study designs.
All right, this one kind of builds off that. In terms of like neurosurgery specific research or different like neuroscience that kind of strays from that a bit, is that seen differently when you're like applying to neurosurgery programs and stuff?
Um, can you repeat the question?
Like, is it, let's see, do research publications in neuroscience or public health carry the same weight as neurosurgery specific?
Um,
Going through the
that's
process.
yeah. I don't really know how to answer that, but I think it's important to like neurosurgery research versus public health research, right? Yes, they're two different fields, but they're overlapping in many different ways. I can tell you that I recently read a study on the epidemiology and changes in craniopharyngioma, which is a type of brain tumor. So that's there's lots of intersections between each of those fields. So rather than taking them as two separate things, if you have interest in both public health and neurosurgery, it's definitely feasible to look at something at the cross section of both, looking at different disparities in care, looking at different areas that have different types of access to different types of treatment. So that's my answer.
Um, are there virtual opportunities for people who are abroad? Is that a feasible thing to get involved in all this research?
Yeah, I think a lot of clinical research isn't something that you need to be present for in person, right? Let's say you're abroad in a different country and you want to work with someone in the United States. I think it's very feasible to reach out to a mentor, identify a question, um, identify methods where you'd like to tackle that question with a mentor and reach out to them, and work on something like a systematic review, a narrative review, or synthesis of literature in a remote fashion. I think it's very feasible. I know firsthand that there are students on either coasts of the United States, people in New York working with those in California, and vice versa. So it's not something that you necessarily need to be in person for. I think a lot of work can be done with data and reviews, and that's truly publishable data. Just similar to other studies as well that I showed, like survey studies or database reviews. So these are all things that can be done on your computer, with guidance from a mentor.
Yeah, for sure. We have a couple more minutes. Could you quickly speak to balancing like your heavy course load with getting engaged in the research?
Yeah, I think it's important to balance both. So I'm between my third and fourth years of medical school, and I can safely say that I didn't do much research while I was in my third year of medical school because that entire time we're pretty much in the hospital rotating from 6 a.m. to 6 p.m. So and after that I have to study for exams. So a lot of research can be done if you're a medical student. I don't know how many medical students are on here. Your first and second years, especially your summers, are great times to get involved in research because that's when you have the most time. Um, if you're in undergrad, if you're in college or between college and some form of graduate school, that's somewhere, that's a place where you can identify a mentor and project and work on something that you can take ownership of. Um, Balancing my schedule, I mean, my schedule consisted of being in the hospital during my rotation. So it was if research was something that I did on the weekends, maybe one day or maybe a few days a month while I was in my third year of medical school. During my first 2 years, I probably worked on several projects throughout the week because there was more time. I kind of definitely wanted to take my studies first because whether you're an undergraduate who's applying for medical school or a medical student applying for residency, someone abroad applying for residency in the United States, I think taking your kind of school and exam and university responsibilities first is much more important because I don't think any amount of research is going to make up for scores.
Um, okay, yeah, I think we'll end it there unless you have any final words for brain turns and how they can get engaged in research.
Yeah, I think just start small and kind of have a goal, reach out to people that you're interested in working with, and have a direction. I think it's one of the most important things to have a direction and an interest. So,
Actually, one last thing. Is this PowerPoint something that the brain turns can access somehow? Can you send
sure,
it
I
over
think
to us maybe?
you
Or?
can start with you or Zoe, and we can share it.
Awesome. Well, thank you so much for coming in and giving us your time.
All right.
And I see some of the next panelists rolling in. Okay, cool. Maybe we'll just take like literally 1 minute to go use the bathroom or grab a coffee or